on you. And we are here talking about Facts Over Fear with some COVID. We have a special guest today, John Petty.
Hello.
What we're going to talk about today is this post-COVID inflammatory syndrome that you hear about and read about on the news. It came out, it was mainly in the kids. And there was an association trying to talk about with Kawasaki's. But as this pandemic and as this COVID has hit more people, it's really starting to hit the adults a lot. And many of the adults didn't even know that they had COVID when they developed this inflammatory syndrome. So unfortunately, John has had an experience with COVID as well as this inflammatory syndrome, and he's going to give us some insight as far as what he's gone through. So if you don't mind, would you give us some history as far as when this whole thing started and with COVID, and just bring us to where we are today?
Back in December of 2020, I found out I had COVID, I think somewhere around December 15th, 14th, something like that. I had fevers and chills, and then I had, I didn't have any body aches. I never lost my smell or my taste, but I did have, I had problems with my sinuses. Just for a couple days, for about 4 days I was down. And then I got released off of quarantine on December 26th. And then, of course, went through the new year and everything, felt fine.
So did you feel like you recovered completely?
Yeah, I felt great, recovered, was fine. I didn't have any cognitive problems or anything like that, no body problems, no breathing problems. So around January 15th, I started working out. I went back to the gym working out 6 to 7 days a week, doing about 45 minutes of cardio and about 45 minutes of weight training.
Now, was that normal for you before COVID?
No. I mean, of course, I used to work out a long time ago, but of course, I wanted to lose weight. I was kind of getting overweight from, holidays and stuff. But,
COVID 30, that's what we call it.
COVID 30, yeah. COVID 30. So I wanted to get back into the gym, and and so for about 6 weeks, I was getting up every morning working out. I felt great. I didn't have any problems. Lungs were doing great. And then about three weeks ago, me and a couple of guys actually they came up to the house, and we decided that we were going to go out. And hunt some javelina. And then I got home, and I was a little tired. I think it was like 8 or 9. I told my wife that I was going to go to bed. So I lay down for bed, and then about midnight I woke up with I had chills like you would not believe. I'm laying in bed and I'm freezing to death. And so the only thing that I could do was come out and get by the fireplace with the blanket and warm up, and then my chills turned into a fever. And then I'd taken some ibuprofen to try to get the fever down. And then I finally went to bed, and then I started having the night sweats.
We're now 8 weeks after COVID.
8 weeks after COVID.
2 months plus when this all started.
So for 6 days, the cycle was I would get chills, then I would get a fever, and the fever would range from 101 to 103, and sometimes 104. And then I would try to take some ibuprofen to get it down. And then I would I'd be fine for a little bit. And it was just this cycle. And then, of course, I came and saw you at the doctor's office.
What day was that?
Oh, gosh, I don't know.
Day 3?
Day 3 or 4, yeah.
Yeah, 3 or 4. During this time when you started out with the fever, and it was the fever and the fatigue and the body aches, right? And then we went on to a sore throat.
Oh, yeah. Well, it wasn't the inside of the throat. While all this was going on, I started having where my voice would be, where I would want to cough, but the pressure in my neck, right here, and inside my neck, and then my head, if I coughed, it felt like my head was going to explode. I mean, it was like, and then I started getting bloodshot eyes. And
during this time is when we had the strep test, the flu swabs, the COVID swabs,
yep,
twice. A rapid and a send out, both negative.
Right. With my head hurting and my neck hurting, and then I was tired, and then I also couldn't eat. I'd take a bite of it, and it was like instantly my gag reflex says I'm going to throw up, so I could only take like 2 bites of something, and so I stopped eating, and the only thing I could eat were fruit popsicles and Jello, and then I drink water. And then Gatorade, of course you had me on Gatorade, and I drank so much Gatorade I started throwing up Gatorade.
First week of going through this is the same symptoms just as any virus would be, as far as the fevers, the body aches, the fatigue. He had more intense neck pain that was going on with that cough. But those are all just viral flu symptoms. And that's what we were suspecting at first, some kind of dehydration or some kind of viral thing. So then moving into week 2.
So moving into week 2, it was Saturday morning, and I told Leslie, my wife, that like I'm fighting back a panic attack because I'm in the unknown, because I don't know what's happening. You know, the tests and stuff aren't coming back fast enough. And so Saturday I woke up and I just didn't feel very good. I guess I kind of got a little scared and kind of panicky because I'm like, I don't know. I said, I trust Chad on what he's doing, but I don't know if it's going to be quick enough, because I'm at a point where my head just feels like it's going to blow off my freaking neck, and I can't get the fevers to go away. I can't get the chills to go away. I can't do, I can't eat. I think by this day it was like 3 or 4 days that I really hadn't eaten. So I told Leslie, I said, we got to go to the ER.
What was so impressive about this was that first week of like the viral, like a regular virus, regular flu would be, an intense one, but a regular virus or flu would be. And then day after day, like these symptoms just kept continuing to progress, where anytime he would even try to speak a word, he would start to cough. And it wasn't like a coughing spell. He would cough almost like if he spoke 1 word, he would cough once. If he spoke 2 words, he would cough twice. And that's not something that's normal. And it just continued to progress until this Saturday when he went to the ER.
So we finally went to the ER. We were there, 11 hours, I believe. It didn't seem like that very long to me, because I was just, the cognitive part at this time, I didn't mention that before, but it went from being very clear to being very cloudy. The doc finally came in, and they were going to send me home, and of course Leslie's on the phone with Gene, or Chad's on the other side, and I don't know if you heard what I said. I said, freaking put Chad on the phone already. No. Something like that. And then Chad had talked to the doctor to run I don't know, some kind of test to check my heart. Not very, you can explain that part, but.
So what was happening was the rest of the lab, if you're okay, if I don't mind me telling you, was the rest of the labs were not showing anything that was very acute or of any concern, and so they were just going to release him because of that. And so I asked them to run some heart enzymes because of the fear of what's called myocarditis, as well as the CTA that we were waiting for that was going to happen on Monday. And so the story came back, well, I'll run it, but if it's negative, then I'm sending him home. And we were like, that would be wonderful if he got to go home and all those are negative. Unfortunately, out of the 3 of them, one came back 50 times higher than normal, one came back 100 times higher than the normal, and the other one was even higher than that. I mean, the numbers were through the roof. So he definitely needed to be in the hospital.
They tested me for COVID again. I think the lady jammed the stick all the way up to my brain, because that was awful. Anyways, it came back, and I had tested positive for COVID after 2 with you guys, the one to send out, and of course the And the doctor's like, well, we got the best one ever, you know. And then about 2 o'clock, they transferred me to the other hospital. Just a quick funny joke, but she thought it was funny. But she had given me my IV and stuff, and I was kind of just trying to get settled in, and she looked over at me, she goes, where do you want this shot at? And it's just a big old needle, and I'm like looking at her like, huh. I'm trying to figure out where I want this shot at, and then she starts laughing at me. I'm just kidding, it goes in your IV. And I was like, all right, yeah, okay, that was funny. I was just trying to figure out where I wanted to put it. But the funny joke about it is she gave me the shot, and I instantly went to go throw up. And so I ended up throwing up everywhere. And I looked at her and I said, see what happens when you scare people? But that's just a little funny part, you know, make some good stuff out of a bad situation. But so I ended up staying in the hospital for 6 days. They gave me the COVID treatment, remdesivir. They gave me some other antibiotics. They gave me some heart medicine. I ended up going and doing another chest CT. Of course, the bad news is all my levels were so high because of the stuff that was going through my body, and my heart was working overtime, I guess you could say. But being in the hospital on the COVID ward was very tough. I mean, it wasn't bad, but seeing everybody come in, double mask, they got face shields on, they're fully gowned, you know, people, it's like they're scared of you, but they need to take care of you. And I get it, I totally understand. But, and they only check on you 3 hours at a time. But the staff they were excellent. They took care of me really well. And the doctors were awesome.
To admit, he's going through the normal protocol for COVID that most hospitals are doing, which is still very controversial. And we'll see where that comes from and where it leads to. But he went through the normal standard protocol, and on that day then released. And how were you feeling at that day compared to when you were admitted?
A lot better. I felt better. I think when I was about that 2 weeks, I lost something like 15 pounds. So Sunday, I was like, you know, I'm going to go to church. I feel like I'm doing all right. You know, I'm still not feeling my best. But I want to get up and go to church, you know, and I get out of the house, you know, because I've been clamped up for weeks now. And then while I was there, I was, you know, doing my regular stuff. And I started getting winded, and I got real tired, and I told Leslie that I was just not feeling well. So I came home, went to bed, and then the next day I woke up and my feet and my hands they were starting to hurt, where like when I walked, it was like painful in my hands. If I moved a certain way, it just shot pain all through my hands and up my arms. And then I think by Tuesday, gosh, it was awful. I could barely walk from one side of the house to the other. I couldn't pick myself up off the thing. I had to roll. I couldn't put my hands down on the bed to go lay down. I had to use my elbows. I saw one of the cardiologists.
So this was 5 days ago.
Yeah, so this was 5 days ago. Put me on some medicine, and so started working with some medicine, and then what's today, Saturday? Mm-hmm. Thursday, my feet started feeling good. I could start walking. My hands were getting better.
Okay, so now 3 days ago.
Yeah, so 3 days ago, I started noticing that the controlling the muscles in my face kind of went away. Leslie and I went to the store, and she got me a drink from that one coffee place over there. Mm-hmm. And so I tried to...
Starbucks.
Yeah, Starbucks. And I tried to put the straw and take a sip of the straw, and I couldn't close my lips around it. And I was like, huh, all right. And so I could put the straw on the side of my mouth and get it to work and stuff, so I did that. But Since then, it's gotten where, you know, I can't, I mean, that's me smiling at my best. I can't move my nose, my eyebrows too much. As you can see, my eyes just going crazy because I can't blink very well, mostly on this side. But just it's the weirdest feeling ever, not being able to move anything on your face. Eating, there's a chore. Trying to keep food in your mouth while you're eating, it's quite embarrassing, to be honest with you. I mean, because you can't keep anything in, you can't close your lips around what you're trying to eat. So anytime I try to chew, most of the time you can keep your mouth closed. I can't keep my mouth closed while I chew. So that's where we're at after 3 weeks. I mean, all in all, you know, the hardest part is when you're going through this, not only the physical stuff is hard, but the mental stuff, the mental things that people you don't talk about is the mental things that you go through. You know, you're sitting in bed by yourself, you know, your wife has to work, the kids are in school, and you're here by yourself, stuck in bed because you can't walk anywhere, and you're just, I mean, you can find yourself going down into a depression. And so I sat there for about an hour kind of feeling sorry for myself, but then I started thinking to myself, you know what, I can't do this, you know, I could dig myself into that would put me where I don't want to be. So I decided, you know what, instead of laying in bed, I'll get myself up, maybe I'll take a shower, and I'll come in here and I'll sit up on the couch and watch TV, you know, because I can't really walk that much, but I'll sit up on the couch instead of laying down. You know, I'll watch something that is educational, you know, something that keeps my mind going. But really fighting the mental part of all this was really hard. I mean, because you think about it, you know, I don't know how long my face will be like this. You know what I mean? And people are like, is it going to come back? I don't know. You know what I mean? If it doesn't, then I got a lifelong smile.
And the thing with this is that, you know, you've heard about one of the neurological parts with COVID and Bell's palsy. But with post-inflammatory syndrome, it affects the eyes, it affects the salivary glands, it affects the heart, it affects the blood vessels, it affects the neurological part of it. It affects all of these things. And so we don't know what is going to happen. We don't know what's going to respond. Still going through tests. And, you know, one of the concerns really is that the left eye is involved as well. And again, in post-inflammatory and COVID syndromes, nobody knows anything. It's watching the numbers to be able to figure out what makes sense and what seems to be some patterns in order to figure it out. And so at this time with John, the only thing that we do know is to try to stop the immune response. So high dose steroids, B vitamins, N-acetylcysteine, zinc, magnesium, and try to help the gut to be able to do that immunity that he needs in order to be able to overcome this. I wanted to, if it's okay with you, have your wife come and we can ask her a couple questions.
Sure.
Is that okay? So this is Leslie, this is John's wife.
Hi.
And what we're going to do is just ask you some questions as far as what you went through while he was going through this whole process that seemed to be happening each day. So during that first week when he started with the chills and the fevers, what was going through your mind for those first couple days?
Like, I was automatically thinking, oh my God, he got COVID again, because he had a fever and chills. So all of his symptoms were just completely what I've heard that COVID brings, because he didn't have any of those when he was diagnosed with COVID in December. So he had no symptoms really at all in December, and he was completely fine, just barely sick. And then all the symptoms you hear about people having, he was having. With the headache, his headache was horrible. He couldn't sleep. He was up all night long, and I was just like, what is going on? I just didn't know. I didn't know what to think. I wasn't sure what was going on because his tests were negative, so I was like, well, it can't be COVID because they were negative, but what's the problem?
Right. It's so hard because there wasn't a flu or a known virus going around at the same time.
Right.
So then getting into that second week towards the end of that second week where things started progressively getting worse and you could see in him
Yeah.
that he was getting worse and worse. What were you thinking then?
Well, I just knew it had to be really bad because like when he's sick, he still will do stuff. Like he'll still function and help out but like I knew he was really sick because he couldn't do anything.
So you noticed a significant change in his behavior.
Yeah.
Okay.
And I was just concerned because I had no idea what to think.
So you were pushy when he got into the ER, which is a good thing because
Yeah.
you got him
Yeah.
taken care of, right?
Yeah.
And that's one of the things where you have this intuition in you, and where you feel like something's not right, and when somebody tells you no, everything is fine, and you're like, I know that something is wrong here, and you were
Yeah.
aggressive with that, which is very good.
They were just like, well, your tests are fine, your x-rays are fine. You don't want to spend the night here. Don't you want to go home? And he was like, I don't know. I just want to feel better. And he wasn't going to do the CT because he said, you don't want to be exposed to more radiation if you don't need it. But then, luckily we did because it showed, those troponin levels.
And that's the thing with this COVID thing and this post-inflammatory syndrome is that there are no rules. Everything is out the door, and there's no patterns that you can follow with this. Unfortunately for them, like the first lab test we did was like $2,000, but it's because we are trying to rule out all these different things that it could possibly be. So when they then put him into the hospital, what happened then?
I had to watch him leave.
Couldn't
He
go,
looked
huh?
awful, and his eyes were bloodshot, and it was just weird because he's on the stretcher and they're taking him away, and I'm like, okay, I guess I'll go home now, and I didn't know what to do, so I just drove home. I cried.
But it's so much we talk about the patient with this part and forget about all of the family that are actually going through this at the same time.
Yeah, and then I knew I couldn't go see him because since he ended up testing positive in the hospital, they were like, no, you're not going to be able to come back and visit because he'll be in the part where there's for COVID patients.
So this whole next 5 days while he was in the hospital, one recurring thing that you kept saying is, I feel like I'm in the dark, like nobody's telling me anything.
Yeah, I didn't know nothing. And then he didn't know nothing because he was just out of it. Like his cognitive was all messed up, and then he couldn't remember anything, and he couldn't focus.
What was going through your mind when you knew he was eventually getting to come home that day? What was going through your mind of what you had to do?
Well, I didn't really know what to do because they sent him home with a packet about COVID, basically telling, in the packet it said, you need to stay home, your family needs to stay home, you need to isolate. And I was just like, wait a minute, does he have COVID still, or is he, like, he's not contagious, obviously. So I was like, do I need to, like, keep him away from us? Do we need to not go to school? Like, should I not go to work? So I don't know. I didn't know what to do again because no one was telling me anything. Like, I hadn't heard from any of the doctors.
So if there's anything that you would want to say to a wife or a husband or family that has a significant other going through this same scenario that you guys went through, what would you say to them?
Lean on your family and just know that, like, they'll get better, and you just pray that, everything's gonna work out, and just go to people like you that you trust and that you can get a great opinion from, and that they can work diligently to make sure that they're not just pumping them full of medicine and actually getting to the root of what's causing, their side effects, and hopefully, and just be supportive, of your spouse, let them rest and expect them to come back and start doing all kinds of projects and go back to work and be 100%, their body has to do their job to recover.
So, John, with all the stuff that you've gone through, if you had anything to say to somebody who was going through this, what would you say to them?
You gotta have faith that what's going on in your life is where God wants to take you. And I know that, some people may not believe in God, or some people don't follow it, but other than that, you have to find something that keeps your attitude you have to keep a good attitude through all this. And I know that there people have passed away from stuff that I went through, and I feel like fortunately I was blessed to make it through. The whole time I was in the hospital, or I was here, I always tried to keep a good attitude. I always tried to make sure that I always thanked the doctors and the nurses that were working with me. Anytime they came in and did something, I always thanked them. Try to be pleasant to them, because a positive attitude can make a big difference in the mental side of it. Physical side, there's days where, just getting out of bed was just a struggle. But you just got to keep fighting, and you have to trust that the doctors and the people who are working on you are going to do what's right. Be strong and be mentally positive can do a lot, and to be thankful for the blessings that we have in our life, because when you're going through something like this, you just don't know. I could have turned for the worst, and I could be gone right now, but I'm not. So I'm thankful for that by all means. My eyes going crazy, but yeah, that's what that would be my advice.
So just kind of recap everything, and to bring it all light with this post-inflammatory syndrome, we don't know what's going to happen. And for John, his symptoms didn't even start till 8 weeks after his quarantine was over with COVID. And he is going through progressions in these symptoms weekly and developing new things, even now being 10 to 11 weeks out. And so the thing to remember is, when things don't seem like they're normal and you're progressing in a way that doesn't seem normal, and if these virus symptoms, these flu symptoms, fevers, body aches are lasting more than 5 days, it's not normal. Something else is happening. And there is no specific one way to approach this. There's no specific one way to test this. But do like what John's wife did, and her heart knew that something wasn't right, and you need to go get that checked out. So the only thing we can do now is take it day by day with John and watch and see what happens, what changes. And we're treating symptoms and trying to stop processes. Just remember, this is all about these facts over the fear. So these are the facts of what's happening right now to a healthy young man who is very active, fit, exercise, works out, quick in the brain, life of the party. 8 weeks later, this is what happens. So there's no explanation for it. Nobody understands it, and nobody understands why it's hitting one person rather than the other. But nobody is out of the reach of it. It can hit any of us, and that's just a fact. Now, you can talk about percentages, and this is killing only less than 1% of people. But we're not talking about killing, we're not talking about death, we're talking about quality of life right now and what can actually happen. And so taking care of ourselves and trying to prevent this stuff from happening, and eating right, and sleep, and stress reduction, and all those things are all super important. But they all have to be happening each day. And even when doing that stuff, it can still hit you. And this is a prime example of that. So stick with the videos, stick with us, keep watching. We're in the middle of the immune support right now, and hopefully we'll give you some things that you can do and that you can implement in your life to help reduce the risks of this happening to us. And don't forget to hit the comments, don't forget to hit the subscribe and the like buttons, and keep them in your prayer, please. He and your family.
Thank you.
Thanks.